Hello. Welcome to today's webcast from the Agency for Healthcare Research and Quality on the SOPS Ambulatory Surgery Center survey. My name is Naomi Yount, and I'll be serving as your moderator for this webcast. Next slide. We have a few housekeeping items. First, if you are having any issues with your computer audio, you can connect to the webcast audio using your phone by clicking on phone call to find the dial-in number and meeting ID, or call me to enter your phone number and receive a call from Zoom. If your computer freezes during the presentation, you can try logging out and logging back in. There is only one Zoom link, so if you log out, you can rejoin with the same link. At any point in today's webcast, you may ask a question through the Q&A icon. We encourage you to share your name and organization or role when you type in your question. Speakers will respond to questions during the Q&A at the end of the webcast. Please note that the raise hand and chat features are disabled. You can download presentation slides and view the agenda and speaker bios on our event website at https://events.westat.com/SOPS. In addition, a replay of today's webcast will be made available on the AHRQ SOPS website in just a few weeks. Next slide. Now I'm happy to introduce our speakers for today. We're pleased to welcome Karen Ginsberg, who directs AHRQ's Consumer Assessment of Healthcare Providers and Systems, or CAPS program, as well as the Surveys on Patient Safety Culture, or SOPS program. I'm also pleased to introduce my colleague, Ryan Hare, a Westat Research Associate who manages the SOPS databases. Again, I'm Naomi Yount, and I'll be moderating today. Next slide. The agenda for today is that we'll start with Karen Ginsberg providing an overview of AHRQ's patient safety priorities and programs. Then we'll hear from Ryan, who will discuss the SOPS ASC survey, database, and various resources available to users. At the end, we look forward to answering questions during our Q&A segment. So let's begin, and I'll hand it off to Karen.
Thank you, Naomi, and welcome, everyone. I'm so happy that you could join us today for this webcast. And I'd like to start off by telling you a little bit about the SOPS program and my agency's interest in this program. So can I have the next slide, please? So the Agency for Healthcare Research and Quality is a research program that's based in the U.S. Department of Health and Human Services, and we are the lead federal agency that's charged with improving the safety and the quality of America's healthcare system. I want to point out that we are not a regulatory agency. We cannot require the use of our tools and our products. We hope you use them and that you can use them for your benefit and quality improvement, but we can't require that you use our tools or submit data to our databases. If there are requirements to use our survey, it comes from another agency or organization. And I just also want to point out that if you submit data to our database, and we hope you will, they will never get sent to AHRQ or anywhere else. They reside with Westat, who has strict confidentiality provisions about protecting the confidentiality of data and protecting data privacy. So on the next slide, please. I want to talk about AHRQ's core competencies. We conduct health systems research, and we invest in research and evidence to make healthcare safer and improve quality. We create tools for healthcare professionals to use to improve care for their patients, and we generate measures and data to help track the progress of the U.S. healthcare system, improve performance, and evaluate the progress of improving the quality of care. And we feel it's important to get our tools and products out to you, our users, and we stress pushing our science to implementation. And the next slide, please. Our AHRQ's patient safety priorities include focusing on the areas of greatest impact, extending patient safety improvements to all settings, preventing healthcare-associated infections and reducing antibiotic resistance, building capacity in the healthcare system to accelerate safety improvements, improving communication and engagement between clinicians and patients, and generally making the safe thing the easy thing to do. The next slide, please. The SOPS program has been funded by AHRQ since 2001, and it's a program to advance the understanding and the measurement and improvement of patient safety culture within healthcare settings. We develop surveys and measures. We support voluntary data submission to the SOPS databases. We conduct research within our program to further the understanding of patient safety culture, and we create tools to help improve patient safety culture in facilities. On the next slide, please. We have defined patient safety culture, and in this way, I'd like to review this definition. We say it's the beliefs and values and norms that are shared by healthcare providers and staff in an organization. And we say that patient safety culture determines the behaviors that are rewarded, supported, expected, and accepted. And that we say that patient safety culture exists on multiple levels. A unit can have a patient safety culture, its own culture, as well as a department, an organization, or an entire health system. The next slide, please. This is the SOPS surveys are surveys of providers and staff about the extent to which their organizational culture supports patient safety. It's individual providers and staff take these surveys, but they are aggregated at the facility level, and you'll hear more about that. Our first survey was the hospital survey in 2004, and we revised it in 2019. We have 4 other surveys as well: core surveys, nursing home, medical office, community pharmacy, and ambulatory surgery centers all have specifically have SOPS core surveys that are specifically tailored for these facilities. On the next slide, please. SOPS surveys can be used in several different ways. They can help you raise awareness about patient safety culture, assess patient safety culture in your organization to identify strengths and areas for improvement, to examine trends over time, and to evaluate the impact of patient safety initiatives. So with that, I'm going to turn this to Ryan. Thank you.
Thank you, Karen. Good afternoon, everyone. My name is Ryan Hare. I'll be speaking today about the SOPS Ambulatory Surgery Center, or ASC survey, database, and related resources. Next slide, please. So the ASC survey is for facilities. Although individual providers and staff are the ones who take the survey, the results are submitted at the facility level for all respondents. ASCs are facilities where patients have surgeries, procedures, and treatments and are not expected to need an inpatient stay, and that have been certified and approved to participate in the Centers for Medicare and Medicaid Services ASC program. Next slide, please. The ASC SOPS survey is designed to be administered to all staff as appropriate. This includes physicians, nurses, nurse anesthetists, technicians, management, administrative staff, as well as clerical and business staff. Staff members can be clinical, non-clinical, part-time, full-time, per diem employees, or even contract employees. To ensure that staff are able to accurately respond to the survey questions, staff should have worked in the ASC at least 4 times in the past month and been working at the ASC for at least 6 months. This ensures that surveyed staff have enough knowledge and understanding of the ASC and its operations to provide informed answers to the survey questions. For staff who work at more than one ASC, the survey should be distributed at the ASC where they spend most of their time, and staff should answer about only that ASC. Now, if staff spend equal time at multiple ASCs, choose one center and have them answer the survey only for that center. Next slide, please. These here are the 8 areas of patient safety culture, or composite measures, assessed by the SOPS ASC survey. A composite measure is a grouping of 2 or more survey items that assess the same area of culture. The 8 composite measures in the ASC survey are each made up of 3 or 4 items for a total of 27 survey items, and are intended to measure communication about patient information, communication openness, staffing, work pressure and pace, teamwork, staff training, organizational learning, continuous improvement, response to mistakes, and management support for patient safety. Next slide, please. The survey also includes a single item to assess near-miss documentation and an overall rating on patient safety. In addition, there are 3 items to assess communication in the procedure/surgery room. Other items include a screener question related to the items that ask about communication in the surgery/procedure room. There's also 2 background questions that ask about the respondent's staff position and their typical hours worked per week. There's also a space for respondents to include their comments if they have any. Next slide, please. AHRQ supports databases for each of the 5 core SOPS surveys. Today, obviously, we'll be focusing on the SOPS Ambulatory Surgery Center database. Next slide, please. The SOPS ASC database is a central repository for survey data from the SOPS ASC survey. Healthcare organizations that administer the SOPS ASC survey can voluntarily submit their data to the database during the data submission period. The database allows ASCs to compare their facilities survey results to the aggregated average results of other participating ASCs. All data that is reported from the database is de-identified. Next slide, please. So why should your first facility participate in the SOPS ASC database? Well, first, facilities that submit to the database are part of the results produced in a database report with de-identified facility level statistics. What you see here is an example of the 2021 SOPS ASC database report executive summary infographic. The infographic is available for download on the AHRQ SOPS website, as well as the full 2021 ASC database report is also available on the AHRQ website if you wanted to check that out. Next slide, please. One of the greatest benefits of submitting to the database is receiving a customized feedback report. Each participating organization receives their own individual feedback report for each facility they submit data for. The reports provide a summary of your results, which includes survey administration statistics, composite measure and item % positive scores, breakout results by various respondent characteristics, as well as a comparison of your survey results to the overall database averages. Now, if an organization submits survey data from more than one ASC within their health system, they'll also receive a system level feedback report in addition to the individual site reports. These feedback reports are produced as a PDF and can easily be shared within the participating organization. We recommend that you share your results with folks at every level of the organization, all the way from leadership to department managers and frontline staff. That way, everyone at all levels understands their areas of strength and where there is opportunities for improvement within the organization. Next slide, please. In terms of database eligibility, eligible ASCs are CMS certified and approved ASCs with a valid CMS certification number, also known as a CCN. You must provide surgical/procedural services to patients that do not require hospitalization, except in unusual circumstances, and do not share space with a hospital or hospital outpatient surgery department. And you must administer the SOPS ASC survey in its entirety without modifications or deletions to the core survey item text and/or response options. Changes can only be made to the background questions at the end of the survey. You cannot reorder or insert new items or supplemental items within the core survey. Supplemental items should only be added at the end of the core survey before the background questions. Next slide, please. So you might be asking yourself, what do I have to do to be a part of the SOPS ASC database? And I'll tell you. The submission process involves a few fairly easy steps. First step would be to register for an account on the SOPS ASC database. Now, even if you've submitted to the database in previous years, you'll need to register for this upcoming round of submission. We'll be sending a registration announcement via the SOPS ASC listserv on June 1st, and you can register at that time or anytime during the submission period, you can register. So the next step then would be to sign and submit a data use agreement, also known as a DUA. The DUA assures ASCs of the confidentiality of their data and explains how the data will be used. The third step is entering site information for each ASC you'll be submitting data for. This includes information such as the site name, the address, specialty type, point of contact information, the number of surveys that were distributed, the dates of survey administration, etc. And it's important to note, for the purposes of the database, each ASC site or location needs to be identified as a separate site. Then the next step would be to submit your questionnaire for our review. We have to review and approve your questionnaire before you're able to submit your survey data. If you'd like for us to review your questionnaire prior to data submission, or even before you administer the survey, you can email your survey to us and we'll review it and provide some feedback for you. The last step in the data submission process would be to, after we've reviewed and approved your questionnaire, is to submit your survey data file. Now, once you submit your data, the system will provide an automatic frequency report that will indicate if your survey data was entered correctly or if there were any issues that you need to address. Next slide, please. All right, so taking a look at the previous ASC database, which was in 2021, the results of that data submission were released in the December 2021 ASC database report, and that included 235 participating ASCs with 8,918 respondents. Next slide, please. So in the 2021 ASC database, 35% of ASCs had 4 to 5 surgical rooms. 84% of participating ASCs were multi-specialty. And then looking at the respondents in the 2021 database, 33% of those respondents were nurses, which was the most prevalent staff position. And 43% of respondents typically worked 32 to 40 hours per week in their ASC. Next slide, please. The 2021 SOPS ASC database report presents average % positive composite measures and item results. As you can see here on this slide, the highest scoring composite measure was the organizational learning continuous improvement composite measure, with an average 92% positive response. This composite measure assesses respondent perceptions about the extent to which facilities actively look for ways to improve patient safety and make changes to ensure that problems do not reoccur. Next slide, please. The lowest scoring composite measures in the 2021 database was staffing, work pressure, and pace at 74% positive. This composite measure assesses respondent perceptions about whether there are enough staff to handle the workload, whether they do not feel rushed, and whether they have enough time to properly prepare for procedures. Next slide, please. On average, 91% of respondents reported that when something happens that could harm the patient, but does not, it is always or most of the time documented in an incident or occurrence report. Next slide, please. On average, 88% of respondents gave their ASC an overall rating on patient safety of excellent or very good. Next slide, please. Regarding the 3 items that assess communication in the surgery/procedure room, I'd like to point out that only physicians and staff who were typically in the room during surgeries and procedures or treatments answered these items. And so on average, 95% of respondents reported that at the start of procedures, team members stopped most of the time or always to discuss the overall plan of what was to be done. Next slide, please. So when can you submit to the next SOPS ASC database? Data submission will be open from June 1st to June 22nd of this year. So we're just a couple months away now. And ASCs may submit their most recent data from surveys administered between July 2021 and June 2023. So just to clarify that, if you administered the survey more than once between July 2021 and June 2023, we only want data from your most recent survey administration, please. Next slide, please. So AHRQ supports 2 database submission periods per year. And in 2023, we will have 2 SOPS databases open for users to submit their survey data. In addition to the ASC data submission in June, the SOPS medical office database will be open for submission September 1st to the 22nd of 2023. So a little bit later this early fall. So we will be accepting SOPS supplemental item set data that were administered along with the medical office survey. So that includes the diagnostic safety supplemental item set and the value and efficiency supplemental item sets for the medical office survey. Next slide, please. We offer many important and helpful resources to survey users. This here is the ASC Survey Users Guide. The Survey Users Guide can be found on the AHRQ website and provides detailed information and guidance about how to administer the ASC SOPS survey. This includes information about getting started with your survey, all the way to analyzing and reporting your results. Next slide, please. After you've administered the SOPS ASC survey, you can use our handy data entry and analysis tool to create tables and graphs of your survey results. The tools use Microsoft Excel to assist with entering survey responses and automatically generate your results. You can also export your survey data into a separate file for submission to the SOPS ASC database. There's a tool for each survey setting and supplemental item set, and we update these tools after each data submission to include the latest database benchmarks. These tools are very easy to use. Users key in your survey data or copy and paste it in from your web survey output into the data entry sheet, and the tool automatically generates your results. It's important to note, though, that to use the tool, you must have Microsoft Excel and you must have the Microsoft Excel macros enabled on your computer. So these tools are not available for download on the AHRQ website. However, you can request a copy by contacting our SOPS TA help desk, And I'll provide that contact information to you in just a minute here. Next slide, please. This is an example of one of the graphs that are automatically generated in the Excel tool for each survey item here. In this example, the items in the organizational learning continuous improvement composite measure, that's items C1, C3, and C6. The Excel tool calculates the percent positive, neutral, and negative response for each item. The tool also provides the percentage of respondents who did not answer the question or selected the does not apply or don't know response option. Next slide, please. Then, after you've administered the survey and analyzed your results, you can use our action planning tool to assist you in developing an action plan based on your results. The action planning tool is available on the AHRQ website and is designed for all SOPS survey settings. It provides step-by-step guidance to help survey users develop an action plan to improve patient safety culture within their organization. This tool includes an action plan template your organization can use to identify your patient safety culture areas of improvement, document your goals, your initiatives, any needed resources, and process and outcome measures, and also timelines. Next slide, please. We also offer improvement resources that you can use to positively increase your survey scores. As you're working on your action plans and identifying areas for improvement, you might also find our Improving Patient Safety resource list useful. This document is also available on the AHRQ website and contains links to practical resources that are free and publicly available to help you improve patient safety culture and patient safety in your ASC. Next slide, please. We offer free technical assistance, also known as TA, to SOPS survey users. Our general TA help desk can be reached by telephone at 1-888-324-9749 or via email, safetyculturesurveys@westat.com. Now, the general TA help desk can help you with questions about survey administration and connect you with any of the survey materials and supporting resources. International users should also reach out to the general TA line in order to request permission to use any of the SOPS surveys in their respective countries. Our database's TA help desk can be reached by telephone at 1-888-324-9790 or via email, databases-on-safety-culture@westat.com. Our database TA can assist with all aspects of submitting to the SOPS database. We're here to help get your data in, and we would be happy to help you through the entire process. We can also help you out with requests for the data entry and analysis tool and answer any questions about the database reports and benchmarks. So you can reach out to our TA lines or visit us on the AHRQ website at www.ahrq.gov/SOPS. And like I said, we're happy to help you, so please don't hesitate to contact us. And now I'll turn it back over to Naomi to facilitate the question and answer segment. Naomi?
Thanks, Karen and Ryan. We can go to the next slide. So again, thank you. You shared a lot of great information about the ASC survey. As a reminder to our attendees, you may ask a question through the Q&A feature. So just look for that Q&A icon. Again, we encourage you to share your name and organization or role when you ask a question. If you joined late or want to rewatch today's webcast, a replay will be made available on the AHRQ SOPS website. in just a few weeks. So with that, further ado, let me see what kind of questions are coming in here. This question is for Ryan from Danielle Reynes. Does the survey also go out to hospital outpatient departments or HOPDs?
All right, good question, Danielle. Thank you. So the survey has been developed and tested for ASCs. So again, ASCs are facilities where patients have surgeries, procedures, and treatments and are not expected to need an inpatient stay, and that have been certified and approved to participate in the Centers for Medicare and Medicaid Services ASC program. So ASCs that do not share space with a hospital or hospital outpatient surgery department are eligible. If the ASC is in a hospital and is sharing space with a hospital, then they would be eligible. So I'm sorry, they would be ineligible. So if the ASC is part of a healthcare system or a hospital system, but is in a separate space, and they have a CCN or the CMS certification number, and the patients that you see do not require hospitalization, except in unusual circumstances, then yes, you can submit to the database.
Great, thank you. Karen, this next question is for you from Nikki Irizarry. And she writes, I'm working on fielding an ASC survey in Florida. The version of the survey from AHCA includes an additional question, has added response options to the main hospital survey, and also has a typo. Do you have any guidance regarding which version an ASC should be using in Florida?
Thanks for that question. I'm sorry, I can't answer it. We're not connected to the Florida program, and you're going to have to ask them for guidance about how to fulfill those program requirements. You can still submit the core data to us if you'd like. We don't accept supplemental items, but if you'd like to submit your core data to us, we'd be very happy to include it in our database. But your submission to our database is voluntary. And again, it's not related to the Florida requirements. We would not be sending your data to Florida or any other potential recipient of data. So I hope that answers your question.
Thanks, Karen. I think that actually answered two questions, saying that it's not required. So thank you for making that clarification. Ryan, this one is for you. Is there a cost to facilities for participating in the database?
No, there's no cost to submit to the database. There's also free technical assistance available to you. So we will help you to prepare your data if needed. We'll help you to submit your data. We'll take care of the analysis and generating your feedback reports at no cost to you. It's really a great benefit. So I hope you're going to participate.
Great, thanks. Ryan, I think this next question is for you as well, from Melinda Loue. With a small ASC, less than 15 employees, is it okay to skip the background info section as to keep the survey more anonymous?
Hi, Melinda. Thank you. So good question. The background questions do not need to be included. Those background questions are not considered part of the core survey items, so you're free to exclude them if needed.
Okay, thanks. And Karen, this next one is for you. Does the ASC SOPS survey count towards the CMS MIPS requirements?
I'm not sure I can answer that one either. I think you have to contact CMS to see whether this survey fulfills requirements for MIPS. I'm assuming that the question has to, I don't know if you're talking on the facility level or the individual level for MIPS requirements, but for either of those levels, I don't know the answer. So please contact CMS.
Okay, thank you. Ryan, back to you. Do you have a list of vendors who administer the ASC SOPS survey?
So again, thank you for the question. There are many vendors that can be hired to conduct your survey, either by paper, web, or both. However, AHRQ doesn't recommend any specific vendors. We can provide you with a list of vendors that have submitted to the SOPS databases, but we don't have information about the quality of the service that they provide. We're not endorsing them. So you'll want to conduct your own research to determine whether you would want to hire any of the survey vendors that we have a list of. You can also reach out to the SOPS TA team to get that list of vendors.
Okay, great. Thank you. Another one for you. Can international ASCs submit to the database? And I'm going to combine this with a two-part question. Maybe you could speak to both. And what do you need to do to use the survey in the country? So first, what do you need to do to use the survey in the country, and can they submit to the database from another country?
Right. Okay, great. Good question. So first, in order to use the survey, you'll need to reach out to our SOPS general TA line to get permission to use it in your respective countries. Once you do that and you have received permission, you administer the survey. Unfortunately, for the database, we can't accept international survey data. We can only accept data from US states and US territories.
Okay, thank you. I see one more question here, and this is for Ryan. Is this survey valid for outpatient healthcare services such as radiology, labs, etc.?
So again, the survey has been developed and tested for ASCs. So an ASC is where patients have surgeries, procedures, and treatments that are not expected to need an inpatient stay, and that have been certified and approved to participate in the Centers for Medicare and Medicaid Services ASC program. So for outpatient centers such as radiology or labs, you might want to try the SOPS medical office survey, which could be administered for those locations.
All right. I'm going to give it just a few minutes. If anybody else has any other questions, I'll give it a minute just to see if they come in. But I think we have run through our list. All right. Well, we can go ahead and go to the next slide. All right, thank you. So we periodically send announcements such as this one through the SOPS email updates, and this notifies users about various SOPS products, webcasts, database submission timelines, and you can sign up for these email updates by going to the top right corner of the AHRQ SOPS or the AHRQ website and choosing email updates associated with the surveys on patient safety culture. Next slide. So as we close out today, a brief webcast evaluation will pop up when you close the webcast. You may have to click continue in your browser to go to the survey, but we ask that you please provide us with your feedback, as it does help us improve our offerings and plan future events. So we invite you to visit the AHRQ website and contact us at any time by email or phone. And thank you again for joining us today, and thanks to our speakers. And this concludes today's presentation.